Start. Welcome everyone. This is a webinar we've put together to look at Microsoft Teams and the functionality that's now available within Teams for NHSMail. Just a bit of housekeeping to start with. So with these webinars, it's an open webinar, which means that you're able to communicate with me and with others. And the ground rule really is to keep your microphone on mute, and then we'll open it up for discussion a bit later on. If you want to communicate either with myself or with the admin team we've got, could you just write into the chat box and we'll be able to pick up some questions, and I've got a screen in front of me to pick up any questions, or I'll certainly be given a message from some of the support I've got. So that's basically the ground rules. So NHSMail has expanded. There's lots of functionality that's now available with it. We've been using it for quite a long time. We've got logins for NHSMail, which has been embedded across the whole of North East London actually. And now with the advent of Teams, it's given us a bit more that we can do. The main things I'm going to cover today are around how you organize meetings, how you can collaborate, and also the OneDrive function that's now available for cloud file storage. So they're the things I'm going to cover. If there's anything else you want me to cover, just put it into the chat and then I can certainly cover those as well. And if there's any other useful hints and tips that you've got, I'll be really keen to get you to share those as well. So let's kick off with the basic functionality of Teams. I'm going to share my screen in a while just to go through this in a bit more detail. And the first thing is really about how do you set Teams up and how do you create meetings for collaboration. Now, Microsoft Teams for NHSMail is slightly different to the Teams that you get in the commercial sector, mainly because it's still sitting on the NHSMail platform. So technically it's sitting on the Accenture platform. We haven't migrated to the normal platform, which is called Microsoft Exchange Online. When that transfer happens, we'll get more functionality and the ability of doing things, for example, better collaboration, inviting other members outside of NHSMail potentially, and also setting up meetings from within Teams. For the moment, if you want to collaborate and organize a meeting, you have to do it through Outlook. So one of the current limitations is if you want to set up a meeting, you need to have Outlook also installed. So that's the first caveat, and I'm going to go through what you need to do. So effectively download and start using Outlook, configure Outlook for your NHSMail, and then download and install Teams. And you have to download and install the Teams app because that gives you more functionality. So once you've got the Teams app downloaded, and we've asked IT support to allow that to be installed without any restrictions, without any admin rights, so that should be quite easy to install. And the other great thing about Microsoft Teams is that it's very device open, so you can use on any device. So if you've got a mobile device or if you've got a PC, Mac, it'll work on any platform, and that's one of the advantages which I'll come on to when we talk about configuring collaboration tools. So I'm going to share my screen now. So let's share my desktop. And I'm going to start off with this page here. So here you can see my calendar view. So I've just stuck it onto a day where I'm not planning to do anything, which is Sunday. So effectively what I've done here is opened up my calendar in Outlook. And what you can see is along the top, there's now an icon called New Teams Meeting. This icon will appear in your Outlook once you've got Teams installed, and we've checked that all of the Outlook versions are at least Office 2010, which means this should work. One of the caveats we've noticed is that if your Windows hasn't been updated, this may not appear. So one of the first things you need to do is to make sure that you've done your Windows update if you can't see this icon. So once you can see this icon, all you need to do is just click on this, and then this will open up a appointment meeting window. Now, what it does here, it automatically creates a link for a meeting. Okay, so this is automatically created for you. So all you really need to do is set a title for your meeting. So the title would be discuss issues around COVID management. And then you put in who you want to invite. So you can put in people that you want. So that you want to come into your meeting. So you put in the names of people you want as required and optional, and then you set a start time and a end time. So you can just have it for as long as you want or as short as you want. And that's it. So when I click send here, this is going to send a email with a calendar invite to these two people that I've put in here, and they will get the link to the meeting as well. The other thing I've often found quite helpful is I right click here and I copy the link, and then I can share it separately if I want to on another email, for example. So that's something else that I found quite useful. And then you just click send, and that will send the email off. And then it's also just put it into my diary. So that's really, really straightforward. So the basic thing here, just to summarize, is that you need to have Outlook installed, and you need to have Teams installed as the app, and then you need to make sure your Windows is updated and this functionality is there and it just works. Then come this day, it's in my diary. All I then need to do is just open up my diary, double click here, click the join meeting link, and I can join the meeting. So it is really, really easy to join a meeting. The other thing I can do, so for example, what I've done here, I've opened up the meeting. I can amend this and I can add more people to this meeting. And if I do that, it'll send an update, and it can just send it to those who I've amended, or it can send it to everyone again. So I will just send that to the attendees that I've adapted, and there you go. So that's really, really quick way of using Teams and Outlook. The other really good tip that I've got here is that because yes, the question is, can you install on any computer? Yes, you can install it on any computer or laptop. How do you update Windows? If you go into your search bar at the bottom, you just basically type in update here. So update, and you just check for updates, or it's Windows update or something along those lines. That's what you need to do there. Another tip that I found really useful, particularly if you've got quite a big meeting that you've organized, is if you open up your calendar here and then you go to scheduling assistant up here, what you can then see is all the people that you've invited, and also once they accept the meeting, you can see that it appears in the diary. So if they accept the meeting, I'll get a notification that they've accepted or they rejected. So I can also get an idea as to who's seeing the meeting and who's definitely coming, or definitely said they're going to be coming. So that's another potential useful bit that you've got in that functionality. So that's how you would use that. And when you actually start the meeting, it'll open up Microsoft Teams, as I've done here, and we'll all be able to have a conversation. And within Microsoft Teams itself, you've got the function to have a chat, you've got a function to look at the participants, and then you've also got an option to share your screen, which is what I'm doing at the moment. So that's Microsoft Teams and using the calendar. I'll just pause there if there are any specific questions on this point, so either on the chat, or if you want to unmute yourselves, you can unmute yourself and ask. So any questions on that so far? No? Okay, I'll move on. So the next thing I was going to talk about was about group collaboration and the collaboration tools that exist within Microsoft Teams. So I'm just going to go into Microsoft Teams. So when you first open up Microsoft Teams, you'll probably see this page, which is basically a Teams page. I'll just go on to somewhere it's quite blank. Let's just, I'll leave it there. So effectively, when you're in your Teams, you probably won't have anything under your Teams on the left here. These are ones that I've created for myself and put on there. So to create a team, this has become a little bit controversial because you can't create it yourself just yet, because the functionality isn't there on the current platform, or it will be there in a couple of months or so. So if you want to have a team created, and a team would be any one of these headlines, or if you want to create one for your own practice, I know some practices have just created a team for themselves. you either do that through contacting IT support, and that's probably the best way that I would advocate, although IT support, as you would currently imagine, are a bit snowed under. So if you're getting stuck with IT support, certainly drop me a line and I can try and help you get one set up. But once you've got a team set up, then you can do lots of different things with it. So I'll just go through the kind of things that you can do with this. So with a team, you can add sub-teams. So sub-teams are called channels. So I can then add a channel to talk about COVID, for example. Okay, and then I've got another channel there. So I can basically have subgroups. I've got, for example, I have my practice team, and then I've got different sections to that team. And then if I am the owner of this team, I've also got the ability to manage the team. So I can basically add and remove. So for example, in this team, which we just made up called VR, we've just got 3 owners and 2 members. And then what I can do is that I can add a member. So let's just add, who should we add? Should we add Sarah? So I'm just going to use you, Sarah, if that's okay. I'm going to add Sarah to this group. And then I can assign her to be a normal member or an owner. An owner has got the ability to add and remove other people effectively. So it's like an admin. And I can select which one I want and then close that, and that automatically then just appears. So now if any one of these people go into their Microsoft Teams now, they will see VR Team with these sub-channels present. So that's something that is quite a good way of trying to manage a group of people who want to collaborate together. And there's lots of ways that we can potentially use this. What we've done in Tower Hamlets is that we've set up a primary care team. And with this, the main thing, this is a opt-in. So if you are not in this group as yet, then if you send an email probably to the CPANs or one of the admins, so either Ekram or Alam or even myself, we can get you added onto this. And this started off with a thought that actually was Victoria, who came up with this idea right at the beginning of how can we have a place where we can share and disseminate information. So that's where this came about. We started off with an ethics forum, but we thought actually we can use this for lots of other things as well. So if you join the Tower Hamlets Primary Care, and then if you go to ethics, you can see that we've already started a discussion here. So you can basically discuss, it's basically like a professional WhatsApp, if you like. And if you download Teams for your smartphone, you can get this on your phone as well. And one of the things that I'm quite keen to have a look at is, can we use Teams as a professional version of WhatsApp? So we keep WhatsApp for personal use and we keep Teams for professional use. So that's still being debated, but it's one of the things that we can explore. One of the beauties of this, and Victoria's done really well here, is that she's put some tabs up here. So here you can form little tabs where you can put references. So here there's a page that's been put in here. So for a web page, a PowerPoint presentation, you can add to tabs at the top, or you can just put specific files in and files to share with others. And it's a good way of trying to find resources quite quickly. And if you've got something that you want to share with others, it's a good platform to do that on. The other thing we've done here, and I'm just going to use a test folder here to demonstrate this, is where you can start having a conversation with someone and you can reference people. So, Alan, did you know about ABC? And then that's effectively tagging someone, so that person will then get a prompt if they've enabled notifications to say a message has arrived on Teams for you. So that's a good way of getting people into a chat really involved. I'll then I can see a few questions coming up. I'm just going to cover this last bit, and then I'll cover your questions. So the file section is really useful, and this is where Teams really comes into its own, I think. And this is where I can share a document, So let's just go into a Word document to start with. So I can be in a Word document, and with this, you don't need to have Office installed. This is all embedded into the online version of Teams, and you can open up PowerPoint, Word, Excel documents. And so I can be editing a document, and somebody else can be editing a document at the same time, and we can both see what each other are doing. And that way we can both share and collaborate on one document, so we've always got one version of the truth. And that's really, really helpful if you've got lots of people trying to update a document, for example, or you want to see what other changes people have made. And it's quite powerful in terms of you can then download it and use it yourself. Or the other thing that you could potentially do is then, for example, you can look at version controls of documents. So if you want to see, what people have edited over a period of time, you can see what changes have been made. So there's lots of powerful facilities that exist within Teams for collaboration. So I'm just going to pause there and just go through some queries and questions, because this has been quite a few comments have come up. I've downloaded the app, but it's not showing on my Outlook. So two things to do there. One, you need to open up Teams first, then open up Outlook just to get it to sync for the first time. And if it's still not showing, you probably need to have some Windows updates done. So make sure your Windows updates are done. Install Teams and install Outlook, and maybe just restart the computer and it should all be there. If not, then IT support, and we can try and focus on what we do. Can you chat to one participant only? No, you can chat to as many people as you want. You can tag and chat to multiple people or a whole group if you want to. Could you share your screen? You can share screen with this. Hopefully I'm sharing my screen. You can see what I'm doing right now, but you can certainly share screen. Do you need a Microsoft subscription? No, you don't need a Microsoft subscription. This is part of NHSMail, and it's the functionality that is available. It's been provided due to COVID as a quick thing. They've rolled out across the whole of the NHS estate. More functionality is coming. I suspect there'll be a strategic direction as to how we fund this going forward, but a decision's already been preempted across North East London that we are using the Office 365 licenses going forward for other things. So this, for North East London, this is effectively here to stay. I've no microphone. Can you dial in? There is a dial-in option. I don't think it's enabled yet, but the Teams has got a functionality for people to join from the phone as well as online. One of the key features of using Teams under NHSMail is that if we go through our governance, which we're looking at, and particularly every practice needs to do this on an individual level as well, is if you are happy for the security of identifier information being shared here, that's also a potential use of this. So potentially we can escalate this to sharing things with other members of the healthcare profession, and therefore it's really important that we stick to making our groups and our teams only secure email enabled. So effectively that means only people with NHSMail addresses should be allowed to be in a team, and I think that's one of the things they're going to build in as a design. How can you present a slideshow to the team meeting? You can present the slideshow really easily. So what I've done is, if I go into here, I'm basically pressing this button here. This is going to start sharing and stop sharing, and that's what I'm doing at the moment with this functionality. So Victoria, I'll bring you in a minute. And as a non-admin, can I set up a meeting? Yes, as long as you've got as long as you've got Outlook and Teams installed, you can set up a meeting right now. So it's really flexible with that perspective. So that's a quick review of collaboration. There's a few more things I can mention, but Victoria, do you want to come in and I can go through and show you anything you want to show?
Yes. I'm not going to show anything. I'm just going to make 3 points regarding the posts. The first one, it offers, Microsoft Teams offers an opportunity to have a lot more tidy discussions, conversations than the WhatsApp group. Especially we need to be a little bit disciplined. So if we need to reply to an existing question, we can use the reply function there. While if we want to start a new conversation, then we can type a new conversation, as Osman has the kind of sign there. So if we are a little bit disciplined, then we will have all the conversations tidy and not jumping from one subject to the other, which happens quite a lot with the WhatsApp. The second point is, because all of us will be members, all members have the ability to edit or delete, not just posts, but also files. So we need to be a little bit careful because any changes we make on this, it will be changes which apply to everybody. So I have created a little bit a PowerPoint presentation on the general tab that you can see. And one of the kind of rules that we need to agree on is that you please feel free. No, that's the ethics forum. The PowerPoint is on the general. Yeah. So if we can all delete things that we write, but we shouldn't really start deleting things that other people have written or files that other people have created, because otherwise the changes will be permanent for everybody, and we need to start uploading documents over and over again. And the third point, I think it's a really great opportunity for the different channels to be focusing on specialities, and we could invite consultants to be part of the group and start conversations asking, informal advice. I don't think, it's something that we may need to negotiate with the hospital. I don't think it's necessarily an appropriate forum for asking specific advice for specific patients, because actually we have ERS, we have other ways to do that. But if we want a generic advice from consultants on how do we treat people with certain symptoms, then that's a really great opportunity to do so, and also, communicate different ways of working, especially during COVID. So that's from me.
Yeah, brilliant. So thank you, Victoria, for that. So yeah, effectively, so if you join the Townley's Primary Care Forum, then certainly have a look at this. We've done a bit of admin changes so that only admins can delete and create tabs, because we had some issues earlier on. But this is part of a learning process. And if anybody's joining us from other areas, we've asked other areas to do the same, and we can certainly replicate what's been done here. But I think thank you, Victoria, for laying down some really interesting ground rules. I'm just going to talk about something else as well, because I've got quite a few queries coming on around Teams and the difference between that and chat, and how we can utilize that as well. So if you have a look on the left, you've also got a chat option. I'm just going to go into here. Let me just go into something that's a little bit less controversial. So effectively, with this, so you can see that I've been having communication and chats with lots of people. And what you can actually do is create a chat with a certain number of people. So what I can do is, let me just close this down. If I've got a group that I'm having a conversation with, then I can automatically start a call or a video call with these people just from this chat function. So the difference between a chat and a team is that chat is very much one-to-one or small group, and you're just basically having a WhatsApp forum effectively, and that's where you would collaborate just in a small group. So think of chat as a WhatsApp channel where you can write things down, or you can talk, or you can have a video call straight from the chat. A team is more about wider collaboration where you're working in bigger groups. And then the meetings function is if you want to arrange meetings in advance and you want to plan things. So that's where I see the different structures coming in. There's a query around how does this relate to Clarity, and I think the Clarity resources that we've got, certainly there's some overlap between the two, and I think what we need to look at really is how do we utilize Clarity and Teams? There is some overlap, there's some uniqueness around the two, and we've commissioned Clarity to be the way that we're publicizing a lot of protocols, processes, and information generally. Teams, we can think about more focused collaboration, whereas we've got particular specialities we want to discuss around, or themes, we can use that. So potentially there is some overlap, but I think we need to work on that a little bit more to make sure that we specify what we're using which one for. Okay, still can't get it running in Outlook. I think if there's issues, we can certainly take that offline and get it to work. But I'll just recap. If you want Teams to work, you need to have Outlook installed, you need to have Teams installed, and you need to have all your Windows updates run. Do NHSMail social workers don't have NHSMail, so can they be added? So everybody who works in health and social care can obtain a NHSMail address. And I think fundamentally that's the message to get across, and then we can collaborate with them. Most of them do have it, but they don't use it because their emails are predominantly stored elsewhere. But I think that's what we need to be working towards, getting everyone onto the same platform for governance reasons, if nothing else. Ghislaine's just talked around, you can share Teams and have a SharePoint. So yeah, if I go back to my Teams, what you're doing is when you're creating a group, you're creating you're creating a SharePoint website. So you've got lots of other things you can potentially do. There's lots of features I'm not even touching because there is so much available. I'm just highlighting the bits that are going to be the most use across all of us at this stage, really. So the use of meetings, the use of collaboration tools are probably the two main things that we're going to be utilizing. I'm going to just pause there, just if there's any other questions, or if anybody else wants to come in at this point, feel free to do so. And some comments. So Ricardo is talking about social media overload. I think, yeah. So certainly, because we've just been dumped into COVID and we're doing a whole load of things, certainly we've all defaulted to WhatsApp because we're all using WhatsApp. And I think WhatsApp's got its place, absolutely fine to use. But I think there's a lot of questions and comments coming back as to how do I separate personal from professional, and using this would be a good way of separating personal from professional use. Again, it's very much a personal choice, so we're not advocating any one over the other, but I would probably be moving in the direction of separating professional use, particularly if we're going to be talking more about patient-specific things, under a professional tool, and Teams would be that tool. Can we use patient identifiers? So the security has been implemented for this to be used for patient use as well. There needs to be some governance. So technically we need to jump through the hoop of getting a clinical safety officer to approve this, which I don't see as a hurdle, but we're in that process to get that approved. On an individual practice level, you can make that decision and certainly use it within your own governance, but I'd be happier once we get an overview completed with our data protection officer involved as well. So that's being rolled out quickly. Whoops! I'm just going to pick up my mouse, which is still on the floor. There we go. So okay, so I'm going to talk about another functionality that nobody really knows about, I don't think, and that's cloud storage. So cloud storage is basically where you've got all your files stored on the cloud, and you can access them from anywhere, which, as long as you've got your login to NHSMail, it's really a positive step. A lot of us are using cloud storage for lots of other things. The problem with us at the moment in a practice level is that a lot of our information is stored locally on the tower drive, which we can't access, for example, from remotely on remote desktops, and it's causing a lot of problems. So how can we improve that? So sharing through OneDrive, through Teams, or through Office 365 is the way to do it. So you've got the professional OneDrive for business, that comes with Teams. So what you need to do, I'll send through the links later on, but effectively if you Google OneDrive login, you can log into your OneDrive. So you basically will get a page where you put in your NHS email address, and then this will open up your cloud drive. So I've got loads of things in here already. I'm using this because I think it's brilliant. So I've basically put all of my files effectively migrate from Tower onto OneDrive. So I can, wherever I am, I can log on to any PC on the web and I can just have a look and access any of my files. And this is great for just remote working specifically. And I'll share some of the really great things around this. So for example, if you are in your practice and you think, actually, I don't want to be logging in onto my OneDrive constantly to access them, can I just have them on my desktop? You can do. So just, again, really be careful about your governance around this and which machine are you downloading this onto. So I wouldn't advocate you do this on personal devices. This has got to be for devices that are used for professional use with adequate security and passwords behind. But there's an option to sync. So when you sync, you can basically sync all of your OneDrive onto your desktop. And that's really great to have access to your documents without having to log into a cloud-based system. So you've got a copy, and whichever one you update, it's always updated. So if you update something on the desktop, it updates it in the cloud. If you update something on the cloud, it updates it on the desktop. So it's truly, in terms of cloud storage, it does what it should be doing. The other really good thing on here, so as I mentioned earlier on with Teams, is if I open up a document here under OneDrive, I can be editing a document and somebody else can be editing the same document if we share a folder, and then we can both have one version of the truth. And that's really, really good for collaboration of documents. How do we share? So what you can do here is that I can either share a folder and I can share it to specific people. So I can define who people I want to share this with and they can view it, or I can let them edit it as well. Editing is only with people within with other NHSMail addresses. So you can't share and allow people outside of the NHS to edit it just yet. I think this is something that's being developed, but again, it's all about governance. So I can share a folder with people, or I could share individual files. And some of you might have seen emails that I've sent out with links in. All of the links are basically with my OneDrive. So I've basically created a link. So I've shared or copied a link, and then this creates a link to this document, and I just copy that and then attach that to an email so I can share a document. So it really means that I'm not emailing large files. I'm just sharing a link, and then people can download this themselves. And it's really, really powerful. It's available, but I don't think many people know about it, and I think we can certainly make use of it. And within practices, that I can see this replacing our local servers, and it's much more robust and much more responsive, and we can access it in lots of different places. So that's OneDrive. I'm just going to pause there for questions and comments, so feel free to enter into the chat, or if you want to come on and discuss, unmute yourselves. So let's have a look. So how long does the data stay on the system? The data stays on the system for as long as you want it. There isn't any timeout for it. Is there a storage limit? Yes, there is, but I think it's quite massive. I haven't managed to fill it up, so I think it's a lot. I can try and find out the exact amount and feedback. How do we speak to one participant? It is clear in Zoom, but not here. You can, so if we're talking about Zoom meetings, I can go back and revise the meeting function. You can invite as many people as you want. The advantage of Teams is that it's you can invite up to 250 people to a meeting, which is quite a lot. How do you get shared drive onto OneDrive? That's just as I said here. So if you want to share a folder, you would just select the folder you want to share, and then you share it, or you can send people a link. I would advocate you share a folder, because when you share it, it appears in somebody else's folder. So if I, for example, if I share this with Ekremel, he will now have access to this folder, and I can say I want him to view it and edit it. And I apply that, I send that through. So he's now got an email to say that you are now sharing 123 test folder with me. And effectively I can then have access to that, and I can add more people, delete more people, and do all sorts of things. So it's quite powerful in that way. And if I look on the left side here, I can have some other functionality. So what have I shared with what have other people shared with me, and what have I shared with others. So there's quite a lot of functionality within this to explore a bit more. Okay, so that's OneDrive with Microsoft Teams. Any comments or questions? So should we get a discussion going? So if anybody wants to unmute themselves, and we can discuss or talk about anything else. So let me just end my screen here. I'll bring my screen back up.
What I meant is that within the chat you can speak to just one person individually. For example, if I want to tell Victoria how did that cake go, I can do that with Zoom, but not with this.
So you're talking about chatting individually or within a meeting?
Yeah, in a meeting, I may want to whisper to Victoria how was that cake that you baked yesterday.
Oh, okay, fine. Okay, so yeah, so you're talking about the functionality that exists, which allows you to chat privately with people while you're in a meeting. I think that's something that I'm not sure where it's coming. I'm not quite sure when. That is on the road. But so basically, if you think of the current version of Teams is sitting under NHSMail at the moment. The plan is to get it on its own, so it works as normal Microsoft Teams will, with full functionality. So there's a roadmap for that to get there. So I think over 3 months we'll be there completely. And because of the fact that they've rolled it out across the whole of the NHS estate in one go, they're just having to phase in the other developments. So that's coming. The other things that are coming, so for example, on your screen you can probably see a maximum of 4 people. That will increase to 9 and potentially more. So there's those kind of tweaks that are coming down the development. So you've got all of these online providers that are competing. So you've got people like Zoom, WebEx, Teams. They're all much the same in terms of functionality. They all do the same thing. My main reason to promote Teams is twofold. One, it just uses one login, so you just have your NHSMail login. You don't have to worry about anything else, and it's got all the other collaboration tools behind it. So if you start using it for meetings, then you can easily bring in some of the other functionality that Teams has with collaborative working and chat, for example. So any other? So yeah, Akram was saying, what cake? Okay, so I think Victoria, you've got a baked cake for everyone. So Emma's mentioned the NHS England webinar allowed you to ask private question. I think that's on Teams. Yeah, so I think NHS England have been prioritised to get the full version of Teams. So we'll be getting that quite shortly as well. So somebody just come on to speak? Did someone just unmute themselves? No. Okay. So effectively, that's the demo from me, just to go through the functionality. I don't have anything else to cover specifically, but happy to revisit some of the stuff I've talked about if you want to get me to go over it again, or if you want to ask any questions. But otherwise, that's basically what I wanted to cover for this webinar. But happy to cover anything else or revisit anything else that anybody wants.
Just to say that sometimes when we explain it like this abstractly, it sounds more complicated than it actually is. So I think when people actually log in and start experiencing the system, is quite intuitive and easy to get around. So, but at least that's what was my experience.
Yeah, definitely. And I would really advocate, if you're not already on the Tamlets primary care, I would really advocate that you do that. I'll link in the chat. Just click on the link, we'll get you set up, and then you'll be able to see this on your Teams page. At least it won't be blank, you'll have something there. And just start using it. I think the best way to learn is to use, and then you'll soon get the hang of it, and then you'll get the teams bug that I've caught, which is basically, you can create as many teams as you want, and then just really start to we can open up collaborative working. I think in a way that now we're working more remotely, we can think of how do we share files and work a bit more productively, and this is certainly a tool that can help with that. And if you've got any other features that you want us to consider, so certainly Victoria's been the brains behind putting this together, so certainly discuss any other features you want, and we can try and get this going. And as Victoria mentioned, we can try and get other specialities involved to try and effectively be moderators, or if there's a GP with a special interest in a particular field, we can create a channel for them to moderate themselves, and they can be the ones who lead on it. So there's lots of ways that we can take this forward, and it's basically the whatever you want to consider or want to dream, we can try and make it a reality. So we've got let's have a look. So really helpful. How do you install Outlook onto your home working laptop? So if you've got a laptop for homework, so all of the machines that we've rolled out centrally should come with an Office license. If you don't have a Office license, for example, if you built a machine yourself, you need to get one. There are very cost-effective ways to get it. If you send me a private message on WhatsApp or Teams, I can link you through to how you can get a Office license unofficially, but it's possible to get licenses that are much cheaper than going through the IT department directly. So Alan sent the link again to link up to the Teams group, and to create a team is IT support, so support at egton.net, or you can go through emisnow.com and get them to do it that way, although it's not a priority for them. So if you do get stuck, drop me a line and I can try and help support you with setting something up. So that's Teams. If there is anything else, feel free to unmute and join, or put it into the chat. I'll be here for a few more minutes, but otherwise I'm sure if you want to leave and do something else, feel free to do so.
Usman,
yeah,
it's Ali here from
Hi.
Time. Just I think the message from Ricardo earlier on about the one-to-one chat when a member of conversation. What I'm noticing in the meeting chat slot on the right-hand side, if you click on the name icon of individuals, some people have the details of their practice and their NHSnet and everything. For instance, Emma Radcliffe, Emma's one, and you go on that, you'll have the details, and there's a chat box there. If you click on that, you can actually directly message Emma on that. Where somebody like Siobhan, or I think Ricardo as well, they don't have that with you, unless, I'm assuming they're not registered or downloaded Teams. So
it depends on how they logged in. So this was a webinar we opened up from a link. So if people can either join with their NHSMail or join without their NHSMail. So that's with a meeting, you can have that option. If you join, you can do what you said, absolutely. So if you're both on NHSMail and you've logged in that way, then you can chat with each other that way. Yes, and if you haven't, then that functionality is in there. It doesn't exist for everyone, so it's not universal. So part of the problem with the rollout is that they're rolling it out not based on locality, so they're just basing it on user. So some people have the functionality, some people won't. So it's certainly coming. But you're right. Clicking on the name, you can privately chat with people if the functionality is being enabled on your system. Thank you. Any other comments or tips? No? Okay. So if there's no others, then that's absolutely fine. So we can wrap this up, and we'll be recording this, and also we'll be able to post it out to you to view again or to share. So thank you for attending.